To whoever is watching my final project video, I just want to thank you for taking the time to look over the work I have done over the course of this 3 weeks that I have been working on this final project. I am really grateful to have taken this class because I have really polished my skills on learning how to research and analyze the methods of a publication and learn what it means to take research in the biological field seriously. Now, moving on to my project. I decided to do my final project on CT scans versus MRI scans and which one are the better of the two options. Although I do believe that one may have more benefits than the other, I do believe that one of these ultimately trumps the other. Now, moving on, we will talk about CT scans. Now, I will explain what are CT scans. So you see, a CT scan stands for a computerized tomography scan, which combines a series of X-ray images taken from different angles around your body and uses computer processing to create cross-sectional images of bones, blood vessels, and soft tissue inside your body. Now, CT scans images provide more detailed information than plain X-rays do. Now, since the CT scans are using multiple X-rays around different angles, that means that there is a combination of X-rays that are ionizing radiation. Now, that means that they are capable of detaching electrons from molecules, and this can disrupt DNA. Now, I want to say that the radiation from CT scans is so minuscule that this is not problematic, and that most of the time you should not be afraid of receiving physician-ordered X-rays because the publication that I reported on is only focusing on pregnant and pediatric patients. Since these patients are younger because they are fetuses while the patient is pregnant that receives a CT scan, it may pose a more dangerous threat to their DNA being damaged since they have more years that it may affect them. So it could lead to possible defects such as cancer, which is quite rare, but it could happen, which is why they recommend that pregnant women do not receive CT scans unless it is of the utmost importance. Now I will move on to MRI scans and what they are. You see, MRI scans, the way they work, they are machines that utilize magnetic field and radio frequencies. Now you may be asking, why is that possible? We're not made out of metal. Well, you see, that works because the human body is made up of 60 to 70% of water, and magnetic field and radio waves rely on the hydrogen atoms in H2O. So you see, these MRI scans actually have radiant coils that help manipulate magnetic field for precise screening results. Now, the image will result in a black and gray and white at different concentrations, depending on the concentration of hydrogen atoms at the area scanned. Now, you may be asking why I think that the MRI scans are more safer when it comes to CT scans. Well, the reason being is because MRI scans use magnets and not radiation. So the threat that CT scans pose on younger patients through altering their DNA and may have a risk of causing cancer is not possible by the MRI. But you do have to take some precautions with the MRI, you see. You cannot have any sort of metal on you. Now, they may include like pacemakers, like maybe like even like a metal plate in your head if you have stuff like that. If there's patients who had amputee and like have a leg made out of metal, they cannot get an MRI due to it being dangerous, and it may even just mess up the results, so there's no point in taking one. Okay, so now that I have discussed a brief description of the two, now we will know what's really the difference between the two. So you see, CT scans take a fast series of X-ray pictures which are put together to create images of the area that was scanned. CT scans are usually the first choice for imaging since it's a cheaper option, but it may result in multiple screenings to get an accurate result. Now, an MRI scan uses strong magnetic field to take pictures of the inside of the body. They are more expensive, but they are more accurate and require less attempts. And they also, like I said, do not use radiation, which some physicians like to point out when to pregnant women when it comes to using CT scans. So, what are some things that you should not do before you get an CT scan or an MRI? So, for your CT scan, you cannot eat solid food 4 hours prior to your exam, but you can drink fluids such as water, juice, or black decaffeinated coffee or tea. Now, some CT scans are particularly abdominal CT scans, which may require that you drink water or contrast so they can better visualize the structure within the abdominal area. Now, the picture on the left depicts a pregnancy CT scan. Now, you may see that it shows a fetus. Well, it makes it hard for doctors to analyze what's truly wrong if they're trying to look for the patient, like the mother, instead of the child. And that child is receiving a little dose of radiation that poses a risk on their health in the future. Now, for MRI, you need to keep metal out of the MRI because the presence of metal can be a serious problem in the MRI because magnetic metals can experience a force in the scanner. Long wires can result in induced currents and heating from the RF magnetic field, and metals cause the static magnetic field to be inhomogeneous, which can cause severe image degradation, which can honestly just mess up the whole purpose of getting an MRI and just for wasting money, since this is a valuable resource that does cost a good amount of money, which doctors do wish it costs less, which is why CT scans are most commonly used. So in conclusion, the MRI scan is the better choice when it comes to screening technology. A great reason why is because MRIs can create better pictures of organs and soft tissues such as torn ligaments, herniated discs, compared to CT images. An MRI does not use radiation, and a CT scan does not use a magnet. Now, where MRI really excels is showing certain diseases that a CT scan cannot detect. Some cancers, such as a prostate cancer, uterine cancer, and certain liver cancers, are pretty much invisible or very hard to detect on CT scan. So metastasis to the bone and brain also show up better on the MRI, which is why the MRI trumps the CT scan. The only thing holding it back is the expensive cost that comes with using MRIs. That concludes my presentation for my final project. I'm really glad you took the time to look over this, and I appreciate you for everything you have done. Thank you, Dr. Hasty.